covered some exposures. I've talked about older adults. And now I'm going to try to pull it together for you in terms of outcomes in older adults from environmental exposures. The first exposure I mentioned was heat stress and extreme weather events. So what are some outcomes that we see in older adults? Well, most definitely in heat stress, there's an effect on the central nervous system. And so we know that older adults are more susceptible to heat stress. CNS effects include memory loss, confusion, delirium. So when exposed to heat stress, we can start to see that there will be impacts on mental health. And then think about mobility, what I mentioned before, and access to food and transportation. These are major concerns for the older population when exposed to heat. In terms of the cardiovascular system, heat will increase the risk for a heart attack. So as we age, we are potentially already at increased risk for cardiovascular disease, increased risk of heart attack, and perhaps one already has a history of cardiovascular disease, and now being exposed to extreme heat will exacerbate that. And that's often a concern when individuals have chronic disease, to think about exposures that may exacerbate existing disease or existing health outcomes. In terms of the gastrointestinal system, there's an increased risk of pathogens that could be from food source, that could be waterborne. It really depends on the population and what their living environment is in an urban area versus a rural area. There's also there's a documented rise in gastroenteritis-related death in older adults. So not only gastrointestinal health outcomes, but potentially death rates that could be attributed to gastrointestinal disease. And then thermal homeostasis. So just something very basic, but still a health outcome. There's a diminished ability for thermal homeostasis in older adults. And they have some difficulty with lowering their body core, the temperature in their bodies with sweat. So because of that, there's also a risk of dehydration in older adults. So again, going back to mobility, transportation, extreme weather events, whether they have access to food, water, whether they're prepared, are they near a cooling center, do they have air conditioning? All of these factors are ways to mitigate the risk. But we have to start thinking about that now, before those events happen. Lead exposure in older adults can lead to a variety of outcomes also. Osteoporosis, which older adults are at risk of, in particular females. Lead can have an effect in terms of bone resorption. While there's a protective effect on osteoporosis in women in people who've been pregnant, there is still a concern with lead exposure. It can affect bone mineral metabolism, and it can decrease mineral density or bone mineral density. There's already an increased risk in older adults of fractures and falls, fall being one of the number one causes of death in older adults. But when you add lead to it and you reduce mineral metabolism and mineral density, now you have an increased risk from fractures and falls. Lead will inhibit the activation of vitamin D and uptake of calcium. So there's chemical effects that lead will have in the body. And of course, that's going to be related to diet. And then there's neuropsychological effects. So lead is a well-known neuropsychological exposure, or a well-known exposure that has neuropsychological, neurodevelopmental effects, but also neuropsychological effects. So imagine multiple exposures right here. I just talked about heat stress and problems with cognition. Now, if you have lead exposure also, perhaps there's that dilapidated housing I mentioned. You have potential for cognitive problems. And this has been studied with lead exposure in older adults, that there's an impact on cognitive function tests. And there's also a relationship between lead exposure in older adults and psychiatric symptoms such as depression, anxiety, irritability, and anger. So lead can have an effect on neurobehavior. Lead can have an effect on metabolic syndrome outcomes. So there's an increased occurrence of metabolic syndrome outcomes, negative metabolic syndrome outcomes. There's also an alteration in thyroid stimulating hormone levels, which would be part of the metabolic syndrome effects. So it has effects on hormones, it has effects on chemicals in the body, it can be related to diet, and it can be related to behavioral outcomes. And then in terms of ANS, or the autonomic nervous system, you can have an increase in sympathetic and an increase in sympathetic activity and a decrease in parasympathetic activity in the ANS. And so that can also be related to heart rate variability. And at that point, we're starting to tie it together potentially with cardiovascular disease or cardiovascular outcomes. So lead is a major problem that there's been some regulation, but again, older adults may have been exposed prior to the regulation, and there may be existing lead in their home environment, such as in old paint that hasn't been scraped off the wall. BPA, which is in plastics and in many products that touch our food, has been well documented and associated with obesity, so both general and central obesity. It's been defined with waist circumference, and there's a positive association between bisphenol A exposure and BMI. It also can affect body weight regulation, so just the ability to normalize one's body weight. In terms of the cardiovascular, we're starting to see some overlap, right, in outcomes. So some of the exposures can come from the same source. Some of these different environmental exposures could all be from a similar or same source. But on the other hand, different sources, different exposures, but we could have similar health outcomes. How do we disentangle that? That's part of where epidemiology and statistical methods come into play. So in BPA, we have cardiovascular system outcomes, such as an increase in blood pressure that's seen in older adults, and again, a risk for CVD or cardiovascular diseases, such as coronary heart disease, heart attack, angina. BPA also tied in with metabolic syndrome, not unlike lead. It does have a relationship, though, with insulin and hyperglycemia, which could be, of course, related with obesity. So you start to see how things start to overlap with environmental exposures. There's the association of BPA with diabetes outcomes and abnormal liver function. And then once again, with autonomic nervous system, much like lead, there's a relationship with heart rate variability. Again, that could be connected with cardiovascular outcomes. And air pollution, big topic, lots of different types of pollutants in the air, but in summation, here's some of the outcomes that are quite common when exposed to various types of air pollution. Respiratory, of course, we all breathe the air. Air pollution is related to reduction in lung function. It's related to an increased rate of decline in lung function and is also associated with emphysema. Now, of course, where does that air pollution come from? Hard to say in terms of what the outcomes could be. You really have to run a study, and then it could be complicated when people are smokers or exposed to environmental smoke. Cardiovascular system, again, we see issues with the cardiovascular system. Here we have increased blood pressure. There's also a relationship with the telomere length, which could have an effect on the cardiovascular disease. And there's an association with, or a possible association with, heart attack and cardiovascular death. Not unlike BPA, there's a relationship between air pollution and insulin. So increased insulin resistance, again, in association with diabetes, which could be related to obesity. And there's also susceptible genotypes that are known in terms of insulin resistance and the relationship with air pollution exposure. And then finally, cancer. This is now we didn't see cancer with the other exposures I introduced you to, but definitely air pollution is a considerable exposure in terms of cancer. Not just lung cancer. Yes, we all breathe in, we all use our lungs, and we're all exposed to pollutants in the air in our lungs, but also colorectal cancer and breast cancer. And we can't rule out the relationship with ETS necessarily. Of course, a study would have to be done in order to determine whether environmental tobacco smoke has a relationship with these cancers as well. Because there's also other cancers besides lung cancers that come from smoking and from environmental tobacco smoke. And then I just wanted to touch on DDTs and pesticides, and that a recent literature has shown that there are intergenerational effects. Now, while it's not talking about the exposures in older adults, it's actually talking about exposures that happened earlier in life and then are carried forward. So it was a grandma and mother and child study, and they found that obesity and early onset menstruation, breast cancer, and cardiometabolic disease were related to DDT pesticide exposure. And those were exposures that had to have happened before the 1972 ban. So remember, there's a lot of regulation on chemicals that happened in the 1970s. But of course, our older adults may have been exposed to DDT. And what they're seeing is that there's an effect 2 generations later.